as well for the victims or the mental health, the mental health working group, because we have a challenge, really a very big challenge in our district of Gulu. It was formerly a very big district, Gulu, but later on has been subdivided into smaller districts again, which are new, like Amoro and Noy. But still, Italian Cooperation is having intervention in those districts, in as far as health, the mental health is concerned. Mental health, it is really a very neglected part of public health, because mental health used to mean very little to people here. But at the moment, I find that people are actually waking up to see what to do with the mental health problem, how to actually solve the problem of mental health, and they are actually visiting the mental health team. Now, Italian Cooperation is one of the partners which is actually supporting the mental health in these three districts of Gulu, Amoro, and Noy. Today is a day of bringing the mental health in the light, because it is long forgotten illness in the community. People think when somebody is mentally ill, they should be taken up to Kampala in Budabika. They should actually be neglected. So the patients have been suffering a lot. Mental health does not only mean when somebody is completely mad and walking naked, doing weird things, but it starts small. So people are advised to come to the clinic to seek for help before actually it flares into a very big magnitude of illness. So today is when the mental health working group, including Italian Cooperation, who are the main supporters of this illness, are showing to the people that this problem can be solved here. Assistance to mental health patients can be got here, and mental health should be taken as a serious illness, just like any other illness.
However, this is an international mental health day. In Gulu, we organize it so as people of Gulu also know what mental health problems are. And it will also create a form of sensitization for the people around.
And I'm here to give a warm welcome to all of you, particularly to the mental health unit. Once you reach the mental health unit, you have reached Gulu Regional Referral Hospital. So allow me, guest of honor, to welcome all the guests, and particularly welcome you, and appreciate the fact that you have been able to leave all your schedules and grace this occasion. I'm very happy with this.
We have the nurses who help the patients. We have the nurses who help the patients. Mental health is here, it will help for sure. It's here at Gulu Regional, it will help. Mental is here, it will help us for sure.
This unit you see in front of you, which is the mental health unit, is a regional unit which was established in around 2003 in line with government policy and Ministry of Health policy and mandate of providing mental health services to the people of Uganda.
Gulu has the potential of actually having a lot of mental health patients because of the historical background in the last 20 years. What has happened? People have been abducted, they have been staying in the bush, so they are so much traumatized, they lost their dear ones, and because of insecurity, there are no jobs, people who resort into drinking and drug addicts. So you find that cases of mental health are really high, but it is actually neglected. We are trying to bring forward the clinic, we are trying to bring forward the treatment, and as well, I'm very grateful that Italian Cooperation has done a lot for this.
caring for the mentally ill is everybody's responsibility. That's why we took a march through the town to tell the people that everybody has a stake in mental health. All of us contribute towards the well-being or managing mental illness. We know that this is a problem in each of our families. We know that every time we walk through the streets, we go to the villages, everywhere we go, there are people having this problem. So today we are calling upon everybody to come and be a part of solving or finding solutions for people who have been affected with this problem. I'm so glad that as we walked through the town, very many people came out to see what we are doing. I don't want to repeat the challenges that we have, but we do still have so many challenges. Talking to the community to let them know that there are services, that it is possible to have treatment for this disease. So we want each of you to be our ambassador wherever you go and tell people that there are mental health services in the Gulu Regional Referral Hospital and in other health centers, as TPO Uganda has been working together with the mental health unit to avail these services in the lower health centers.
The songs they play are all referring to, and this is integrated mental illness in primary care. Now, still they are not fearing any mental patient here. So what we need is to bring our patients, our brothers, wives, husbands, children. Once they are mentally sick, please, this is the place. Don't fear to come here.
I'm very happy meeting Matikakwero Mental Health Day. I think it is the first one. You take care of your clothes, you take care of your teeth, but you forget what is in the study. Is it not so? We spend a lot of money on the hair, but what the brain contains, the skull contains, you forget. And therefore, it appears not to be a priority. And that's why we are commemorating today that take care of your brain. It is the control of everything, and it is the most ignored. It is the most ignored, and once you show features of being a little bit different, then we say that is a mental case. We now stigmatize that is a gone case. And that is the problem. But if we strictly put a weighing scale and put our brains and we shall find 99% of us have one form of mental disorder again. Okay? So it is part of us. We are integrating it among ourselves. The primary health care is you and me. Let us accept that mental health exists, and we must tackle it. That is the message we would like to give. If it has not been a priority, it must be a priority to you, to me, today. very happy to our partners. I'm very happy to Gulu Hospital. I'm very happy that you have made this day possible. The first time for us to have a mental health day. The first day that we are trying to make the awareness. Not only, mental health is not the responsibility of the health workers alone. It's our responsibility.
We are happy, very happy to receive you, our patients. You are warmly welcome in mental health.
Day to day, I've shown that mental health is really important part of health in the community, and the people should be treated with some dignity and equal treatment actually is required for them. I'm very grateful for this.
Final guest of honor, let me especially thank, as I've said before, the representatives of these NGOs, or organizations or donors who have been very, very supportive to us. I will mention them again, not to repeat them, but just to stress the support by the Italian Corporation to this mental health unit. They have done trainings, and one of the equipment we are supposed to use, or we are about to use, was actually donated by the Italian Corporation. It's an equipment to test the mental status. It's called EEG. I'm reliably told that they are going to train some of our staffs to use this equipment. And I really want to thank them for this support. I will not stop to mention APSI, Watoto Church, and of course TPO is always with us. The urban office just next door, and most of the support has come from that organization. Please kindly accept my appreciation on behalf of the staffs of the hospital. So our guest of honor, allow me to once more welcome everybody to this function, and I wish you a very good duration throughout the function, and I thank you for coming.